Before using the HeartStart on-site defibrillator, verify that the patient is in cardiac arrest by establishing that the patient is unresponsive and is not breathing normally. Assess responsiveness. If the patient is unresponsive, immediately call 911 or the emergency medical services number for your area. Open the airway and check for breathing. Usually, a person in sudden cardiac arrest is not breathing at all, but sometimes abnormal, ragged breaths occur for a short time after collapse. If the patient is not breathing normally, give 2 rescue breaths. If the on-site is not immediately available, perform CPR until someone can bring it to you. If in doubt that the patient is in SCA, apply the defibrillator. Using the HeartStart on-site defibrillator is very easy. Place the defibrillator on the same side of the patient that you are on, near the patient's head. If the HeartStart on-site is stored in its optional case, unzip the case. Pull the green handle to remove the hard cover of the pads cartridge. This will automatically turn on the defibrillator. You can also turn it on by pressing the green on-off button. The HeartStart on-site will start giving you clear, calm instructions timed to match your pace. Remove the clothing from the patient's chest, cutting it off if necessary. Then peel the film seal from the cartridge and take out the pads. Next, you must place the pads. Peel one pad from the liner and place it on the patient's bare chest, following the illustration on the pad. It does not matter which pad is placed first. Then peel off the second pad and place it. Be sure the pads have been removed from the liner before placing them. If the defibrillator senses a problem with the quality of pads contact, it will instruct you to correct the situation. As soon as the pads are properly attached, the HeartStart on-site automatically begins analyzing the patient's heart rhythm, or ECG. Rescuers should not touch the patient while the defibrillator is analyzing. The triangular caution light will turn on and start flashing as a reminder. The on-site will tell you if a shock is advised. If a shock is advised, the caution light will stop flashing and remain on, and the orange shock button will start flashing. Before pressing the button to deliver the shock, you must make certain that everyone is clear of the patient. Check visually that no one is touching the patient. Instruct everyone to stay clear of the patient. Press the orange shock button to deliver the shock. The shock will not be delivered unless you press the button. After delivering the shock, the on-site immediately tells you to begin CPR and provides a CPR interval. During the first 30 seconds of the interval, you can press the flashing blue I button and the on-site will provide CPR coaching.
Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches.
Provide CPR until the patient begins breathing or moving, or the on-site tells you to stop CPR or not to touch the patient. Leave the pads attached to the patient and the on-site turned on in case additional shocks are needed. In all cases, continue to follow the defibrillator's instructions until the emergency team arrives. When the EMS team arrives, let them know that the HeartStart can tell them how many shocks it delivered and how long it has been since it was turned on by pressing and holding the blue I button until it beeps. This information will be helpful to emergency medical services personnel as they continue to provide care to the patient.